1205. But right now it's Robert Dozier, Executive Director of the Mississippi Independent Pharmacies Association. What about it there, Robert? How you doing, man?
Good morning, my friend. How are you today?
So yours is an industry that is, shall we say, dynamic. Is that one way to describe it? And we wanted to have you in to talk about what appears to be just a rash of pharmacies that are closing across the country.
Yes, it is across the country. It's in Mississippi, but it's not just unique to Mississippi. It's across the country as well.
How does this affect areas where maybe there's only one pharmacy serving a rural community, for example?
It's devastating because pharmacists are the most accessible healthcare provider out there, especially in your independent pharmacies in the rural areas across Mississippi, Louisiana, Alabama, Tennessee, Arkansas. The independent pharmacies are seen as true healthcare providers that provide a service and adequate healthcare to their local communities. And what we're seeing across the nation in the independent world and also in the chain world, that pharmacies are closing. And when you start seeing that, you're going to run into pharmacy deserts. And in a rural state like Mississippi, a pharmacy desert is a bad thing.
Well, and of course, folks in the rural areas need prescription drugs and the other things pharmacies provide just as much as we do in the more populated areas. So it's not unique.
Well, not only are you going to lose a healthcare facility in that area, but you're also going to lose an economic driver as well, too.
That's a good point, yeah.
You know, you start sitting here and you want to recruit businesses like Amazon, Nissan, Toyota, and that's all great. Don't get me wrong. We need more business here in the state of Mississippi. But we also need to focus on the business that we already have and keeping them viable as well. Because you start looking at just in the independent pharmacy world, there's roughly 350 independent pharmacies in the state of Mississippi. And you start taking, doing the multiplier of about 10 to 12 employees on average, and that's going to be conservative for each independent pharmacy. You're looking at 3,500 to 4,000 individuals being employed. Probably, I would imagine that number's going to probably be a little higher, probably 4,000 plus. So then when you start looking at it that way, then you're looking at an Amazon, a Toyota, and everything.
Man, it's a big old problem. So what about Walgreens? Have they not been ordered to pay back some dollars with respect to the PBM situation?
Well, from some of the reading that I did, it was a few weeks ago, I think, Walgreens got in a little trouble. I think it was a whistleblower case. The Department of Justice came down on them, and I think it was somewhere around $100 million that they're going to have to pay back. And it was basically from what the article said, they were filling the prescriptions, but the prescriptions were never picked up.
Okay.
So sometimes, I don't know the ins and the outs of that case, but sometimes what happens is the doctor's office might send over a prescription, call in a prescription to a pharmacy. The pharmacy fills it. The patient never comes and picks the prescription up.
Okay. So
it's the job of the pharmacy to pull that prescription back and reverse the claim. They have a certain amount of days that they can do that in, and it's anywhere between 7 to 14 days or whatever if the patient has not picked it up. From what the article said was Walgreens, it was a pretty lengthy time period, if I remember correctly. They filled the prescriptions, patient never picked it up. They did not reverse the claims. So it was a whistleblower case, maybe a little fraud involved, I'm not sure, but Walgreens was ordered to pay back a little bit over $100 million.
How are some of the Biden policies that are related to prescription drugs and pharmaceutical companies, Medicare negotiating pricing, capping the price of insulin and so forth, how's that affecting the independent pharmacies?
Well, I had a conversation just the other day with one of my independent pharmacy members, and we were talking about the insulin and some of these drugs that they are negotiating with and everything. And the key is The government can negotiate these prices as much as they want.
Okay.
It's going to be left up to the Medicare Part D plans, which are the PBMs, if they include them on the drug formulary. The Medicare Part D plan and the PBM, they're in charge of the drug formulary. So if the government is over here negotiating these price discounts on these certain drugs, they have to also guarantee that they're on these formularies, and so that the patient can receive the benefit.
I see. Does it affect their margins, their profit in any way when this happens, or is it just at the wholesale level?
Oh, yes, it very possibly can, because this goes back to what the conversation was I was having with my member. Is his question was, how are we going to get paid in this? What is the mechanism for us to get paid? We're going to dispense this product, this prescription drug, and we have to get an adequate and fair reimbursement for this.
Sure.
And that is the $1 million question right now. And we have not heard that from the Biden administration yet.
Might this also trigger more pharmacies to close?
It very possibly could. I have a good member of mine. He made this comment a long time ago. He said, "It's not the government's job to make me a living, but there again, it's not the government's job to put me out of business either." And we have to come up with a solution to where the drug manufacturer makes the drugs. They produce the product. It gets to the pharmacy fills the prescription. It gets to the patient that needs the health care. And we need for the pharmacies to have the chance to receive an adequate and fair reimbursement. And we also need the patient to be able to know they're getting the health care they need and deserve at a fair price. Right now, the patient is not getting the prescription at a fair price. They are getting twisted and turned in so many different directions. It's unbelievable.
Seems like they're always the last to be considered in the equation.
And they should be the most important.
Yeah. And it's not just it's the entire healthcare industry. It's not just the pharmacy.
It is.
In the pharmaceutical aspect.
You and I have had a conversation about the entire healthcare industry several times, and let's just say it needs a major overhaul.
Man, it does. Are you seeing anything coming from either of the presidential candidates that concerns you or excites you with respect to your industry?
Vice President Harris had made a soundbite concerning the PBMs. This was maybe several months ago. When President Trump was in office, he was about to make some change concerning the PBMs and how they operate and such, and then he was not reelected. So, this is on everybody's radar out there. We've had a lot of congressional hearings in D.C. We've had some hearings here in the state of Mississippi. We've had other hearings in other states as well. So this is an issue that is a lot of conversation is being had, and we've got a lot of work to do in the future if you want to keep these independent pharmacies viable to where they can stay in rural Mississippi and across the country and provide adequate health care to their patient population.
Yeah. I mean, they've at least Harris has released plans which mainly involves just continuing the subsidies from the Affordable Care Act and the enhanced subsidies they passed in the Inflation Reduction Act, which are set to expire next year, and then a whole discussion about lowering prescription drug costs, which includes what we've been talking about, letting Medicare negotiate and capping the cost of drugs. I think they want to extend these caps to more than just insulin.
Yeah, they do. They've started off with about 10 drugs, and they want to increase the number of those prescription drugs every year.
Man, well, it seems like that the element of just not knowing has got to be stressful for your members. For
my independent pharmacists out there, it is a very stressful time.
Like it is in all businesses. We're trying to get some understanding and clarity on just simple tax policy, for example, that could be a huge factor.
That is true.
In making business decisions.
That is true. Right now, it's very hard for an independent pharmacist to make a business decision a year out. They're day to day.
Man. Robert, always enjoyed talking to you. Appreciate you coming in.
Same here, my friend. Good
Thanks
to see
a
you.
lot. Robert Dozier, Executive Director for the Mississippi Independent Pharmacies Association, has been our guest. We're going to step aside for a break. Coming right back in the Element Wealth Studio.